Hello, lovely speech therapy professionals. Today I want to discuss how to generate severity levels and prognoses quickly and accurately. My name is Chung Brewer. I'm a speech language pathologist, university instructor, and author of an online course called the Adult Speech Therapy Roadmap. This video is meant for speech therapy professionals who just want the job to feel a little easier while still providing excellent care. Let's get started. In a previous video, I discussed how to score and generate a quick diagnosis and plan of care on the spot while you're still in the room with the patient. Now you're back in your office and you're typing up your assessment report. You have some room to breathe, but you still want to write a high-quality report without it taking forever. At this point, you already made a broad diagnosis, something like aphasia, dysarthria, dysphagia. Now let's come up with a severity level to attach to that diagnosis. Some screens and assessment have severity levels built in, like the MOCA or the MASA. But many times we complete informal assessments that don't have those severity levels built in. Maybe you're new to the game, or you haven't had experience seeing this spectrum of severity for a particular diagnosis. Here's what you do if that's the case. Use this simple formula. When your patient completed a simple task, something like naming, identifying photos, taking single cup sips, taking single bites, use this formula. If they needed a little help or had minimal symptoms, severity is mild. They needed a lot of help or symptoms were obvious, severity is severe. Somewhere in between, severity is moderate. Sounds super subjective? It sure is, and it's your call to make. You have the credentials to make that decision, so go for it. What we want to do is move on to the next task. I don't want you to be in the position I was in as a new clinician, staring at the computer screen, having no idea what to write, and slowly filling with dread as I think about all the other things I have to do. That's no fun, and it doesn't help you or your patient. As you see more patients, coming up with severity levels will feel easier because you have a range of patients to compare. If you have no professional experience to compare your patient's performance with, trust your education and training. Use a formula as needed. Discuss your thoughts with a trusted colleague and move on. So overall, you could base severity on the amount of help your patient needed, a little or a lot, and how their symptoms presented. Minimal, obvious, somewhere in between. Now let's talk prognoses. Prognoses are predictions about how it's believed a disorder or disease will play out. They're similar to severity levels because the prognosis you make is going to be based on your professional judgment and is inherently subjective. That being said, there are things you could do to make a prognosis as informed and as accurate as possible. First step, zoom out. You're going to take an eagle-eye view of all the information you just gathered, especially previous level of functioning, which can be found during the chart review, current level of functioning, which is what you just gathered during the interview and assessment, and amount of caregiver support. You can also consider things like current age, other comorbidities, onset of diagnosis, level of awareness, severity level, and motivation. Based on this information, ask yourself this question. How do I think the patient will respond to speech therapy? The answer can be excellent, good, fair, or poor. Most of our patients will be in the excellent, good, fair range. Here's what each of those mean. Excellent prognosis. Progress is expected to be fast. Most to all goals are likely to be met. Your patient is expected to return to an independent level with their goals, and they'll likely return to nearly previous level of functioning. For good prognosis, steady progress is expected. A majority, if not all, of the established goals are expected to be met. Fair prognosis, minimal or some progress is expected, but some goals may be met too. There are patients who have poor prognoses where progress is not expected to be made and no goals are likely to be met unless there's a lot of compensatory strategies in family education. This prognosis is usually reserved for patients who have end-stage or chronic progressive diseases. Speak with your supervisor before working with patients who have poor prognoses to make sure that their insurance will cover it, especially for maintenance therapy. So to summarize, to make a prognosis, ask yourself, how do I think the patient will respond to speech therapy? Answer with excellent, good, fair, or poor. Make your best guess, and that's your prognosis. It's based on your professional judgment, based on a snapshot of time with the patient, and that's okay. They help us get the ball rolling in therapy. Prognoses help us generate feasible long-term goals, those dream big goals. Again, you'll naturally learn more about the patient as time goes on. It's impossible and not expected that you know everything about the patient from one assessment. But during that one assessment, you can still get a general idea of how you, as the boss speech language pathology professional, can help. The job isn't to be perfect. It's about using our tools within our scope of practice to help our patients become as safe and independent as possible to increase their quality of life. So that is a lot of information. We have written some of this information out for free on our website, adultspeechtherapy.co. If you're interested in getting a step-by-step guide on how to do the job from day one to discharge, you may be interested in the Adult Speech Therapy Roadmap online course. You can see more info about the course on our website on the right-hand side. I'm Chung Brewer. I hope this video can add value to your practice. Thanks so much for watching. See you next time.